So welcome everyone to the quarterly data quality process for Q4. My name is Alexander Fuller. Just a couple of housekeeping things before we get started. Everyone currently is on mute. This webinar is going to be recorded and should be available within our help desk articles by Wednesday. Also, I strongly encourage everyone to use the questions function of GoToWebinar and ask questions in real time as we go through the presentation. There might be time left at the end to address any outstanding questions, but to ensure that we have enough time, try to ask them as we're going through, and I can answer them while we're still on the same slide. Okay, so what we're going to cover today is kind of go over the reason why we have data quality. We're going to go over missing data values, child-only entries, utilization, and timeliness. We're going to go over who participates, the report details, an overview of the process, the dates and the times, submissions, the data quality timelines, access and reviewing the report. So I'm going to share my screen, and we're also going to go through a couple of troubleshooting things during that time as well. And then resources and support that we have. And then if there's time left, we can address any questions or any remaining questions. Okay, so to get started, the Chicago Continuum of Care utilizes data-informed approaches to coordinate services and resources in efforts to end homelessness. The Homeless Management Information System, which is HMIS, data quality is an important factor in measure efforts to end or prevent homelessness. The COC relies on the work of all providers of all funding types to enter accurate, complete, and timely data to ensure we have the information we need to make informed decisions as a community. So what this really means is that data quality is very important in HMIS. Since we do use HMIS to represent, our community, it should be as accurate as possible. So when we're looking at things, we have an accurate understanding of the work that everyone is actually doing. So due to the importance on data, in order to maintain data quality, providers in HMIS are expected to participate in the quarterly data quality process that address data in the following 4 areas, which is missing values or data issues or data inconsistencies, child-only entries, bed utilization, and timeliness. So to go over the first piece of it, we're going to look at missing values and data issues. So this information is going to be found in the business objects data quality report that you're going to run for your projects. On the summary page, you're going to see this table, which you see on the left side of your screen. So in this table, no more than 5% of clients enrolled in the project can miss any data element, including data not collected answers. For name, social security number, and date of birth data elements, client doesn't know and client prefers not to answer are counted as errors. So what this means is that all other data elements except for name, social security number, date of birth, if you choose client doesn't know or client prefers not to answer, that's not going to result in an error. Only for name, social security number, and date of birth. Data not collected, if it's chosen for any of the data elements, is going to be represented as a missing value or an error. So the data elements that we're looking at is name, social security number, date of birth, race and ethnicity, gender, veteran status, prior living situation, length of stay in previous place, relationship to head of household, client location, domestic violence, disability at entry and exit, income at entry and exit, non-cash benefit at entry and exit, insurance at entry and exit, and then also the destination for clients that have exited. One thing to note when you're reviewing your data is to look at the required for column. That's going to let you know what data element is being looked at for what clients. So if you look at data elements such as name, social security number, date of birth, all clients are required to have those answers completed in their assessment and have valid answers for them. If we look at veteran status, the only clients that are going to be counted towards this measure are adults, so clients over the age of 18. So if you have children enrolled in your project that's missing a veteran status, that's not going to be represented in this report. Another thing to also look at is things such as disability at exit, income at exit, non-cash benefit at exit. So if your client hasn't exited the project yet, you're not going to be measured on this particular measure. So the next piece of it, which has been around for a bit, back in 2024 or 2023, the end of 2023, the data standards changed, which combined race and ethnicity, which used to be two separate data points. Within the data quality report, we haven't made that adjustment just yet, but race and ethnicity is combined. So you're going to notice in the summary tab A and the details tab B that in the summary tab, the percentage under ethnicity is always going to be 0%. And then in the details tab, in that entire ethnicity column is going to be marked as retired. So you're going to see all red in that column as retired. There's nothing to address or nothing to correct. And in the summary tab, you should never see anything other than 0%. So you can kind of just disregard that. It's just existing within the report. It's going to be removed at some point, but right now you'll still be able to see it. Any questions before we move on to child-only entries? Okay. Send the message that the meeting will be started. It wasn't previously started. I lost all audio. Okay, so in your situation, if you've lost audio, you might want to restart the presentation. But if a lot of people aren't able to hear me currently, can you just let me know in the chat? Okay, wonderful, wonderful. Okay, we do have another question. What if it's a negative in the section in the required area? So if you're looking at the summary tab or the details tab and you have a negative in one of the columns, that just means that measure isn't being counted for that particular client. Is either due to them not being an adult or they're not being the head of household. There's some reason why they're not going to be counted in that measure. And you should be able to kind of identify that by looking at the required for column for that particular data element, and it'll let you know the clients that should be counted. Okay, so the next piece is going to be child-only entries. There must be 0 child-only entries in your project unless your project is funded for youth. If that's the case, then let us know. But ideally, no client or no child-only entry should exist in your data. A child-only entry is flagged when a client is under the age of 18 and is enrolled in a project without being connected to a parent or guardian. Typically, this happens for 2 reasons. Either the child came later in an existing enrolled household and the child just wasn't connected to that household appropriately, or the client's date of birth is missing from their assessment, which would result in them being a null value. And again, if you have a project that serves unaccompanied youth or funded to serve youth, please just let us know and then we can make that adjustment via the results. So we do have a question, will the slides be sent out? So I can send out the slides during the next email that we send out to providers, but typically the slides will be located on our help desk articles at the very bottom. You'll be able to find the slides there. Any questions on child-only entries? Okay, so for utilization, bed and unit utilization must be within the following ranges. So for emergency shelter, transitional housing, it's between 80% and 105%. For permanent supportive housing, rapid housing is 85% or higher. And for safe havens, it's 85% through 105%. So utilization for the majority of project types, look at how many clients were enrolled in your project on November 21st, 2024, as compared to how many beds and units are indicated in your bed and unit inventory sheet. So what this first piece means, first is that November 21st, 2024 is going to be the point in time date for this iteration of the data quality. So all of the utilization is going to be based on this date. What this first piece means is that for project types such as emergency shelter, transitional housing, safe haven, that's going to be an exact count of the active clients enrolled in your project on November 21st compared to what your inventory looked like as of that day. For permanent supportive housing and rapid housing, those project types require that the client have a housing move-in date on or prior to that point in time date, November 21st, to be included in utilization. So if you have a permanent supportive housing project or a rapid housing project, and you have clients that don't have a housing move-in date prior to or on November 21st, they're not going to be included. So if you have a client where their housing move-in date is before their enrollment date, they're not going to be included. If you have a client that was housed in your project on November 22nd, 2024, they're not going to be included either. Only clients that are housed as of that date will be included in utilization. So the way that utilization works is as long as either the bid or the unit utilization meets compliance, the project as a whole will be considered compliant for utilization. So in this table that you see here is exactly how it's going to look on the summary page of your data quality reports. You have a bed utilization at the top, and then below you have a room unit utilization. These are two separate measures. So as long as one of these utilization is within the compliance measure, so either 80% or 105 or 85 or greater if it's permanent housing, then your project would be compliant. So this time last year, we did make an adjustment to the details tab of the data quality report, which added a housing and move-in date column. This is really important for permanent supportive housing projects and rapid housing providers, so you're able to see the exact clients that are being pulled into that cumulative count. So again, permanent supportive housing, rapid housing must have a housing move-in date as of that point in time date. In this particular column, you will see things such as date out of range. What date out of range means is that this client has a housing move-in date, but that housing move-in date doesn't fit within the point in time date. So either their housing move-in date is before their enrollment date, or their housing move-in date is after the point in time date. So this doesn't reflect an error when you see data out of range. It's just letting you know that that particular client isn't being counted in utilization. If you look the client up, you'll be able to see the housing movement date that's provided for this client, so you'll be able to see the reason why they weren't included. But when you see data out of range, it doesn't necessarily mean it's an error. But you might want to review it just to make sure that this client is truly shouldn't be counted. Okay, so we do have a question. Is rapid housing included in utilization this quarter? So yes, rapid housing is going to be included in utilization this quarter. So we put in a lot of work to realign rapid housing back to the way that we previously looked at utilization for rapid housing. The change had to do with how we had to report rapid housing to HUD. So we've kind of refigured how the report pulls in that data. So when you run the utilization reports that's currently available, you should see a percentage for Rapid Rehousing projects for utilization. It should have an inventory, and the inventory should reflect the last time that we received that information, which would have been the 2024 housing inventory count. So that should be reflected of what was submitted then. If you run the data quality report now for your Rapid Rehousing project and your unit or bid inventory is null, then we ask that you reach out to the help desk so we can sort that out. That's either due to us not having that information for your project, or a different reason, but we do ask you to reach out so we can sort that out for you. We have another question. Clients transferred to Rapid Rehousing projects that are already housed have a move-in date that is before the enrollment date to the new program. Would this affect the data? So when it comes to client transfers from one permanent housing project to another, what should happen is that once the client is exited out of the existing project and enrolled into the new project, another housing movement date should be added for that new project that reflects the enrollment date. So an example would be if a client enrolled January 1st of 2020 and their housing movement date was March 1st of 2021, and they're transferring in 2022. Your new enrollment, let's say it's January 1st of 2022, the housing movement date that you're going to need to put in is January 1st of 2022 to reflect that the client is housed. So right now, what it sounds like is that you have a client where their housing movement date is before their enrollment date, and when looking at utilization for your project, that prior enrollment date or that prior housing movement date wouldn't be included. It's not connected to that particular project. So yes, the enrollment date is the movement date in situations of clients being transferred from one permanent housing project to another. No problem. Any questions? Any other questions on utilization? Okay, so timeliness is another piece of data quality. So timeliness is tracked through the automated reports created by AllChicago. This report will track the timeliness at entry, exit, at housing movement date, and for shelter services. Timeliness measures the time it takes to create an enrollment or an element in HMIS. This measure applies even if the entry date is backdated. So for instance, if a client originally came into your project 12/1/2024, but they were not entered into that project in HMIS until 12/4/2024, the information would be considered out of compliance as it took 3 days to indicate that the client was enrolled. Timeliness data cannot be corrected. So when you receive these reports via email, there's more of more informational than it is a call to action to do something in the system. But again, what timeliness is really looking at is that the time that the data actually went into the system versus the timestamp that you're indicating that the data was completed on. So who participates? So all projects, regardless of funding, are required to participate in the quarterly data quality process, so long as the project is active and has at least one client enrolled. So that just means within Q4, we're looking at Q4 of 2024. So as long as you have your project was active and you had at least one client enrolled during that time, then you would be included. If you started funding in Q4 2024, but you didn't enroll your first client until January 1st of 2025, then you wouldn't need to submit a data quality report because you didn't have any clients during that time period. So we do have a help desk article that does list all of the currently active projects that are expected to participate. You can take a look at this article just to kind of confirm what projects we have on a list. If you do review that list and you notice projects that you don't use internally or should be inactive or no longer operational, we do have a help desk article on project deactivation with a form. Please submit that and we can work on deactivating that project from the system so it doesn't show up in any more of these lists. So the report details. So when you're running a report in business objects, the prompts are already preset for you. So you don't have to make any adjustments to the dates. Only thing that you'll add is the project that you're running it for, so the project ID number. All reports must be generated for one project at a time. So if you have 3 emergency shelter projects, you shouldn't run one data quality report and include all 3 projects in it. Each project needs their own individual data quality report. The report will be looking at the period from October 1st of 2024 to December 31st of 2024. In the report, the point in time date is set for November 22nd, 2024. That's to include that additional 1 day that the prompt asks for. But ideally, when you're reviewing the data, it's gonna only be pulling in clients enrolled or with a housing moving date as of November 21st. So although the prompt says the 22nd, the data is actually gonna be looking at the 21st. So for Q4, this data quality process will go from March 3rd, which is today, to March 14th. There's only 1 round for submission, so providers will not need to send in data quality reports until they're ready to for final submission. So you don't have to send in kind of individual reports as they be generated or as you're making corrections. You can just send in one final report once you're satisfied with the results. The business objects reports, which can only be downloaded by users with access to business objects, will cover the following, which is the missing values, child-only entries, and bed utilization. Again, changes made in HMIS will not generate in business objects until the following day. So this is really important if you're making changes up into the last day, so up until the 13th. Just keep in mind that the 13th will probably be your last day to make changes to submit your report on time for the 14th. Any changes made on the 14th wouldn't be available until Saturday the 15th. And then the timeliness report is a report that's going to be sent out to ATAs, which will be sent out sometime this week. And again, there's no corrections that need to be made with the timeliness report. It's just informational on the timeliness for Q4. Can you repeat the data elements that will not be counted against the project if it shows null on the report? So there's a couple of things, right? So I could go back to that slide really quick. Okay, so there's 2 things when it comes to the ethnicity column on the summary and on the details. On the details, it's going to say retired. On the summary, it's going to have a 0% for that measure. So this isn't going to be counted towards the project in any regard. And then also when it comes to things such as data elements that's not required for a particular client. So if we're looking at veteran status for adults, if a child is missing a veteran status, that's not going to be counted. So those are the only kind of examples in which things wouldn't be counted in data quality, where you might see a missing value. So if you're looking at the veteran status column on the details and you see that it's missing for children, you can kind of eliminate them from your review because they're not going to be looked at. Okay, so for the submission process, so this is really important when you're submitting the reports, just making sure that everything is done accurately, just because you want to make sure that we're receiving them accordingly. So reports are to be submitted by March 14th, which is the deadline. Excel files must be renamed using the Chicago DQ _ year month date template. So for the dashes, you're going to replace that with the project ID number. And then for the year month date, you're going to replace that with the date that you're submitting the report. One thing to keep in mind is that the project ID number must be 4 digits. So it must be 4 characters. So if your project is a 3-digit number, if your project ID number is 3 digits, you're just going to want to put a 0 before your project ID number just to make it 4. And that way it can make sure that it's following the correct format to get included. So when you're submitting the reports, you're going to be submitting them to Chicago DQ or data quality, or you're going to be submitting the data quality reports to dataquality@allchicago.org. It must be this email address. Anything other than this is not going to get included in the results. So if you're submitting it to an individual person at All Chicago, or if you're sending it to the help desk, that's not going to be counted as submitting your data quality reports. The subject line must be data quality report submission attachments, just to make sure that they're getting filtered appropriately to the right spot so that the results can be calculated based on the files that you're sending in. One thing to note is that you don't have to send in individual emails per project. So if you have 5 projects that you're running data quality reports for, you can include all 5 Excel files in one email for submission. So there's no need to send them separately. One thing that we've seen quite a bit of, which just need to be ensuring that when you're downloading a report, you're downloading it to the right format, is PDF files being submitted. So if you're submitting a PDF file, we're not going to be able to include those results in, we're not going to be able to include that file in the final result. So it has to be an Excel file so we're able to extract the data out of it. So just make sure when you're running the data quality report in Business Objects and you're exporting a file, just make sure you're exporting it to an Excel file. Yeah, so we do have a question. Will we receive copies of the presentation and the recording? So the recording and the slides will be available on our help desk, are both our help desk articles. So if you received the reminder email so far, you have 2 links for running the data quality report and then also the data quality overview article. Both articles will be updated to have this presentation as well as the slides at the very bottom. The next email that we send out, I'll be sure to include the slides in that as well. Any questions on submission or sending in the reports or anything that we've covered previously or so far? Okay, so the data quality timeline started off on February 24th and the 27th. We sent emails out to ATAs just to letting them know that the webinar or to register for the webinar and the data quality process is starting. The correction period is going to be from March 3rd to March 13th, which is the day before the submission date. The submissions are due on March 14th, but to ensure that the corrections that you're making in the system are able to be pulled from business objects the following day, all corrections have to be done by the 13th. If you make corrections on the 14th, then you're not going to be able to submit a report with those corrections on the same day. And then following the 14th, the following week, we'll post the results to data quality on our help desk article, and we'll send out an email just letting everybody know that the results are available. Okay, any questions before we move over to the live presentation or the demo presentation? Okay, hopefully everyone can see my screen. Okay, so if you aren't able to see my screen, which is now showing community services, just let me know in the chat. But when you're getting started to run the business objects report, you can find business objects in one or two places, either in the top right corner here or within the reports tab on the left side at the very bottom under business objects. So if you click on it, it's going to open up a new tab for you. You can find the data quality report under folders, under public folders, Chicago Live, Chicago COC reports, data quality, and you'll be able to see the Chicago DQ underscore year month date report. So when you're running this report, please make sure that when you look at the description, it says version date 2/24/2025. It's important that you're running the most up-to-date report. If you're running a report and it says retired in the beginning of it, then you're going to want to make sure that you're going to the actual folder to retrieve the more updated report. If you right click on this particular report, you are able to schedule it. So if you're in the process of working on correcting errors for a particular project and you think you're going to want to have a copy of this report every morning when you get into the office, then you can schedule that report. If you click schedule, it should open up a window here, which is going to let you schedule it. The destination, you're going to choose the BI inbox. And then for the reoccurrence, you can select it to just run one time, reoccurring based on a lot of different factors. So hourly, weekly, business hours. And then you can set the day ranges for when you want the report to stop and end. Be mindful that by default, it's going to suggest that it's going to run for 10 years. I recommend you to narrow this down to a few months. But once you have that set, you can go over to report features. From here, the only thing that you're going to want to change is the prompt information. So these prompts are going to be the exact same thing you would see in the business objects report if you're just running it in real time. So if you click edit prompts, the only thing that you're going to want to change is the select provider. Again, you're going to only want to select one provider at a time. You're not going to want to run 5 different projects in one report, you're going to only going to want to run one project per report. And once you have that selected, it's going to open up similar to how it prompts for just a standard report that you're running. Yep. So you're going to just change or add in the project that you want to run. Once you do that, it'll appear here and you'll be able to schedule it. But if you're running a report just in real time, if you click on the report, it's going to open up. Okay. So again, the start date, the end dates, and the point in time date are already pre-selected, so you don't have to make any adjustments to that. You'll be able to search for your project ID number here. For this example, I'm just going to search for our internal test project. And once you select the project, you'll run the report. Okay, great. So we have the report here. And at the top, you can see all of the tabs that's available. When you're downloading the report, you can click on the export button here. When you do so, you're going to want to make sure that you're selecting all reports. So you don't want to submit the report, your data quality report without having all the tabs here. And under the content section here, you're going to want to make sure it says report, and you're not going to want to click data. You're going to have the full structure of the report. Again, it should only be Excel that you're exporting to. PDF is not going to be accepted. I wouldn't even click CSV, although this is Excel as well, but just click on the Excel here at the top just to be sure that your report is going to be included with no issues. So once you do that, you can export the file. It will save to your downloads folder, wherever you have your files going. Just kind of a quick overview. At the very top here, you'll have your date ranges, so you can, if you're reviewing this later, you'll know that what dates this data is reflecting. You have your project right underneath it. If you have more than one project here, then that means that more than one project was selected initially, and you're going to want to run them individually. Here you can see the data elements that we're looking at. Again, be mindful of the required for column just so you know what clients are being captured for what measure. The next column is going to give you a count of the applicable clients that's going to be included. So you can see here where all is 7 clients or 7 applicable entries, and then head of households only is only 4. So that just means that there's 3 clients that aren't labeled as head of households. That's part of another household. And then at the end, you'll have your error percentages. So if it's in red, then that just means that it's over 5%. One thing to kind of just be mindful of is that this is based on just the errors themselves, that the project can't have more than 5% of errors. So if you have a project where you have 100 clients and only one error, it's not going to show under 5%. But if you have 2 clients enrolled in your project during that time period and only one client has an error, then now you're at 50%. So just be mindful of your client counts. If you have a small amount of clients enrolled, then more than likely you're going to have to fix everything that's being reported. If you have a lot of clients and only 2 or 3, then just focus on the things that are in red and then address anything after that. Child-only entries is going to show a cumulative total here underneath it. There is a tab for child-only entries that'll show you the details of what makes up this cumulative total. Below is going to be your utilization, the bid inventory, the number of clients enrolled or households enrolled. This right here is a good example of if you're a rapid rehousing project and you run the data quality report and your bid inventory is blank here, as well as your unit inventory is blank, please reach out to us so we can work on updating your inventory in the system. The sooner you're able to reach out or verify that information, the quicker we can make that adjustment. The next tab here is the client details key. I think this tab is very important, especially in understanding the details tab, because it's pretty overwhelming depending on how many clients you have. So this is going to give you a details on exactly what all the color alerters or the color flags mean. What does the abbreviations mean? Mismatch versus HUD verifications, or null versus data not collected values, as well as give you the location of all the data elements that's being reviewed. So for example, if you're looking at social security number, so social security number for data quality is located in the client profile. So you're not going to find this in the entry assessment. Even when it comes to the housing movement dates, it goes over how housing movement dates work when it comes to permanent supportive housing and rapid housing projects. On the details tab, this is where you're going to actually see the errors that make up those cumulative totals on the summary. So if you have null values, you're going to want to go through and correct those. One thing to kind of be mindful of, which is typically the case, is that when it comes to sub-assessments at entry versus sub-assessments at exit, if you have a situation where you have a HUD verification at entry and exit for your client, or a null value at entry and exit for your client, you're going to correct that. The first thing you're going to want to address is the at entry piece of it. So typically, if there's an error at exit and at entry, typically if you fix the error at entry, it will also fix the error at exit. So it's important that you start there first and correcting any inconsistencies when it comes to sub-assessments. Okay, so for child-only entries, again, clients that show up here either doesn't have a date of birth or they're not connected to a head of household. So their age is under the age of 18 and they're not connected to a household where there's someone over the age of 18 assigned as the head of household. So you'll see that here. Inventory information is going to reflect, so one thing to really note here is that there's 2 tab Ds now. One is inventory information that's going to represent inventories for all projects except for rapid rehousing. So if you are a rapid rehousing project and you're looking for what your inventory currently looks like, you'll look at the tab D, rapid rehousing only inventory tab. And that's gonna show you exactly what it looks like. Right now, it doesn't show up here just because it only populates if a rapid rehousing project type is being run. So if you run a rapid rehousing project, you're not going to probably see this table in the first tab, but in the second tab, you'll then see the table. So depending on your project type, you'll either see the inventory information in inventory information or rapid rehousing only inventory information. And then at the end is just additional information about the project, just gives you a cumulative count of all the enrollments, and then just give you some details about the report that you ran. Is there any questions on the data quality report itself or running it? Okay, so just really quick, I wanted to go over a couple of things that I've seen. So when it comes to rapid housing or permanent supportive housing projects, those projects must have, or those clients must have a housing movement date as of the point in time date to be counted in utilization. So when it comes to the housing movement date, it's going to always be via an interim assessment just because that's where the housing movement date question lives. It's within the assessment that's only visible via interim. But one thing to note is that if you have an interim review and it's labeled update housing movement date, this in itself is not a housing movement date. So if you have an interim review and you have a date here and it says update housing movement date, this is not considered adding the housing movement date. This is an interim review. So if you go to the interim review or you go within it, you'll see that the assessment that's tied to it is the update assessment. Depending on your project, it might be different. So if you're a PAV project or a RIDE project or VA, you guys have different assessments depending on the funding. But it's all going to be the same in terms of the type of assessment it is. So it's going to be an update type assessment. And the housing movement date that's going to be looked at for utilization is the one that's located in the assessment. It's not going to be the review date, and the interim review type isn't counted as a housing movement date. It's only the actual housing movement date question which is going to be counted. And again, our housing movement date or our point in time date for this iteration is 11/21/2024. So in this case, this client would be counted. But if their housing movement day was the 22nd, then they wouldn't be counted in utilization just because the point in time date is for the 21st. Although their date is the 22nd, it doesn't indicate that this date is wrong or you should go in and change it. It just means that for this iteration of data quality, they just didn't get included in utilization, and that's fine. Another thing that I really quickly want to hopefully get to is when it comes to adding additional household members. So if you have an enrollment, or let's say you have two clients and they're supposed to be in an enrollment together. So one is the child and one is the head of household, but they have different group ID numbers, which means they're separate enrollments. To connect them, you are going to have to go to the head of households enrollment. You're going to click on the start pencil here. And what you're going to do is include additional household members. So if you don't see the client here, you're going to exit or cancel out. You're going to go to households, the households tab, and you're going to add the client that you want to add to the enrollment to the household first. So in this case, I'm going to add a client to this particular household. And we're going to click on the client. And if you come down here, we can see that the client was selected. We'll click continue. And you can just click save and exit. So now when you go to the enrollment, you'll click include additional household members. And now you'll see that this additional household member is able to be added to this existing enrollment. So if you click continue, You can click save and continue, and now you see that you have 2 clients enrolled in the enrollment. Now, if you want to adjust the date for the second client, so since this client came in after the fact, they didn't come in on 10/1/2024. The way to do that is that you can't do that from the head of households profile. You'll then have to navigate to that client that you just enrolled in. And if you come here, you'll see that the enrollment is here, and you'll click on that enrollment date, and you see that both clients are selected. You're going to unselect the head of household because you want to retain that 10/1/2024 date. And let's say they came in today. We can change the date to today. Click save and continue. So now we can see that we have one enrollment, and we can show that the original client that was here came in on 10/1/2024, and their additional household member came in on 3/3/2025. And it works the same exact way for interim review. So if you have an interim review that a client should have been captured in, you'll go to the head of household. You'll include that additional household member in that existing interim review. So any questions about that before we jump back to the slides? Okay. Could you go through the steps again on how to select the correct project? Can you say a little bit more about your question? I'm sorry. Selecting the reports. Okay, so when you're running the data quality report, I don't know if this populate quick enough. Okay, so when you're running the data quality report and you're selecting your provider, you're only going to select one provider at a time. The list that you're going to see is going to have all the projects in the system. So at the very top here, I recommend that you search for the project ID number. We do have a help desk article that lists all of the projects that are supposed to participate. So you can get the project ID number from that list. You'll put that here. And once you do so, for example, I'm just gonna do PSH. But if I was to search for 1415, it would have populated here. And there's nothing else that you would need to adjust, and then you can just select run. So this is where you'll select the project when you're running the report. So we do have a question. If a client changes projects, how can we manage that? And will it cause a timeliness issue? So it kind of depends on the situation. So if it's a situation where the client is transferred to another project, then the expectation is if it's within the same agency that the original project will have an exit date added to that enrollment. And then you'll enroll them into the new project. There shouldn't be any timeliness issues with that. If it's a project transfer between agencies, and you're inheriting clients that were already enrolled in the project, there shouldn't be a timeliness issue with that either. So yeah, if you have any examples, just add it to the chat here, or if you have specific situations, you can submit a help desk ticket and I can help you walk through that. Okay, so to kind of jump back to the slides, for troubleshooting, again, we do have this ledger here that kind of goes over all of the details of the details tab of the data quality report. Again, if you have any questions outside of what's available in this details key, please reach out to the help desk as soon as possible with those questions. When it comes to resources, we do have two articles on the data quality process, the data quality process overview, and running and interpreting the data quality report. Both of these articles will be updated with the recording of this webinar as well as the slides. And then also at the bottom are just some additional links to articles that we have. So sub-assessments and HUD verifications, documenting the housing movement date and relationship to head of household. So these three articles are kind of just going over the main questions we typically get. So just review those. And if, again, any questions outside of that, please reach out to the help desk. And then also for data quality, we do know that there's, new providers, new ATAs, new staff joining all the time, and this is probably their first time doing the data quality process, or even providers that, been around for some time. We do offer office hours assistance. So what that means is that we'll have a 30-minute call and we can kind of talk through any concerns or any questions you might have about your data quality report. You can request one of these just by submitting a ticket to the help desk, just asking for a session. So one thing to kind of keep in mind is that we do ask that at least one person on the call have access to business objects or is the ATA. And it just makes it a little bit simpler in terms of being able to have someone that's able to run the report or run something in business objects. So what typically happens is that we on an HMIS team can't run reports on providers' behalf just because the reports that we receive is going to include way more data than that you might be able to see. So you might have errors on your data quality report, and when we run it, we don't see those same errors just because there's other data in the system that either didn't cause the error to populate or other reasons. So it's just important to have the perspective of the agency during these calls, just to make it a little bit easier to understand what the problem is sometimes. And in addition to that, if you reach out to the help desk for assistance in about anything data quality wise, I strongly recommend to include the data quality report in that request. So even if it's kind of a simple question about your data quality report, just include an attachment of that report just so we can have a point of reference when we're reviewing it or trying to confirm if what the right answer is for you. Again, when we run reports on our end, they don't come out one-to-one with what you see. So there are definitely times where you'll see an error for a particular client and we're unable to recreate that error in business objects. Okay. Thank you everyone for joining today. We are over about 2 minutes. I will stay on for an additional 3-4 minutes if there are any outstanding questions. But again, thank you everyone for joining today. Have a great rest of your day. All right, thank you, everyone. We haven't had any additional questions come in. So if you do have any questions after the fact, please reach out to the help desk. Again, thank you, everyone, for joining, and enjoy the rest of your day.